Let's talk about the worst day following your total knee replacement surgery, and typically the worst day is going to be day 3. If you guys don't know me, my name is Tony Maritato. I'm a licensed physical therapist and I specialize in treating patients after a total knee replacement surgery. I have a large Facebook group. It's called the Total Knee Replacement Support Group for Kind People. And basically I ask group members what was the worst day after surgery, but I also ask my own patients, what do you think the worst day after surgery was? And most of them will say day number 3. Of course, there's some who say day 5, day 1, day 10. Some patients are still having their worst day and it's 3 months after surgery. I understand there's some variability, but typically the worst day is day 3, and I think it's for a couple reasons. One is the acute anesthesia has worn off and now you're starting to feel the real pain, discomfort, soreness from the surgical procedure itself. Not just the soreness and pain from the knee replacement, but from the actual surgery. The second reason is you're typically starting to hit that wall. You're sleep deprived. You can't find a comfortable position. You're getting frustrated. Hopefully you're not dealing with side effects from the medication, but a lot of times people are. Some people are dealing with the effects of anemia because they lost blood during the procedure and they haven't built back those red blood cell supplies. And it's just a general kind of, you're getting worn out. You know, day number 3, 72 hours after surgery is where you're just kind of hitting that wall. Most of my patients will turn the corner around day 5. They'll start to feel some improvement. Their energy will come back. The nausea will go away. If they were having any bowel or bladder issues, that's usually resolved by then. And now they're starting to feel like they're actually making progress. I typically tell all of my patients to give it at least 10 days to recover from the surgical procedure and then start to focus on the rehab. During those first 10 days, we're still working on range of motion, reducing pain, reducing swelling. But if you can, I try to give all of my patients those first 10 days just to recover from surgery, and then going from day 11 to really about the 4-week mark is where we push to gain range of motion, to improve standing, walking, mobility around the house. And then from week 5 to around week 12, that's where we regain most of our function. So that's where we're talking about walking and standing and doing all of the things that you need to do functionally around the house. You're typically off the walker, you've returned to driving, you're sleeping back in bed, hopefully you're sleeping again, and you're starting to feel like you made the right choice having the knee replacement surgery.